Welcome everybody to today's session. Today is part 2 of 3 of understanding addiction. And today's video is going to specifically talk about the addiction cycle. The cycle that I use comes from Craig Knockin's book, The Addictive Personality. And I do highly recommend reading this book if you yourself are struggling with an addiction or if you're a family member of someone struggling with an addiction. It's just a great read that really, I believe, explains addiction and the addictive process very clearly and very well. So please get that book and read it and tell me what you think. If you haven't watched part 1, which answers the question from my perspective, is addiction a disease? And if so, what kind of disease? Then please watch that video, either just after this one, or please pause this one and watch that one and come back. This will make perhaps a little more sense if you watch that one first. Again, as a quick review, we talked about addiction in the last video of being a dis-ease, a way for people to cope with life challenges, to experience a relationship, to find happiness, and to find relief. So what is it that people are trying to cope with or find relief from or happiness from? My experience is most people struggling with an addiction have an extreme amounts of pain in their life. And the pain that we're talking about here predominantly is emotional pain. And this pain can be a variety of emotions. The most common are anger and resentment, depression or anxiety, loneliness, fear, worry, stress, or low self-esteem. Now, I'm sure there's other emotions that create pain or have us experience pain in life, but these I find are the predominant emotions that people are struggling with when they have an addiction. Now, where does this pain come from? Well, it can come from a lot of things, but oftentimes it comes from traumatic events or experiences in one's life. That can be recent or all the way from childhood. But trauma often is at the root of the pain and of addiction. And we'll come back to that later. But just understand that oftentimes it's trauma or a perceived traumatic experience. And there's a lot of different kinds of trauma. There's what we call big T trauma, which can be considered physical, sexual, emotional abuse. And there can be little t trauma and just little experiences in life that stress us out over time that can become traumatic because of frequency. Regardless, whether you've experienced big T trauma or little t trauma, it's often that trauma that it creates the pain. And the pain is what someone with an addiction is trying to find relief from. And that's step B. B is the desire or the want of relief. They just want to escape their pain. And we live in a world and a culture that we don't do well with emotions. We're not taught effective and healthy emotion regulation skills, so it's very easy to turn to addictive behaviors and substances to learn how to cope with these feelings. And so if we can start to look at addiction as, again, a way to cope and find relief from these unpleasant emotions, I think we're going to have some more compassion towards ourselves if we're the one struggling with it, or we'll have more compassion towards a loved one and a friend that's struggling with this. And again, not just thinking that they're trying to upset us or trying to make life difficult for us and just being jerks. They're not. These are people who are experiencing a lot of pain. So that leads us to C, which is the using or the acting out in the addictive behavior. And addictions come in all forms. Some of the most common ones that I've worked with and that most people struggle with will be drugs, alcohol, gambling, sex and pornography issues, Now video gaming is becoming a big addictive behavior in our society. Food is obviously very addicting. Shopping and other addictive behaviors. So those are just the common ones that seem to cause the most pain and destruction in someone's life. Oftentimes this is figured out through just experiment or through life experiences. Somebody may, at a young age, experiment with drugs or alcohol, but find very quickly that, wow, this works. This takes away the pain that I've been experiencing. And it doesn't take long for the brain to go, hey, give me more of that. I want relief from this pain. And it's easy, and it's quick, and it's effective. That's the problem with addiction, is that it's effective in the moment. No, it's not effective long term, but most people struggling with an addiction aren't worried about the long term. They want to feel better now. You want to feel better now if you're struggling with an addiction. I get that. And the consequences, the people that you're going to hurt, the damage you're going to do to your body, or whatever the negative consequences may be, you're not thinking about that. You're just thinking about the relief. And that's the power of addiction. But if we do this too much and too often, then what's going to eventually happen is the addictive behavior itself is going to lead us to more pain, or what I call pain squared. And this also brings emotional pain. This emotional pain is predominantly the feelings of guilt and shame, with the biggest challenge being shame. Shame in this example is toxic. What's the difference between guilt and shame? Guilt is feeling bad for what I've done. Shame is feeling bad for who I am. Now I'm a bad person. And this shame can create negative core beliefs such as I'm not good enough, or if people really knew me, they wouldn't like or love me. So here it is. This is the addictive cycle, or we can call it the pain cycle. And this is what addiction is all about. It's not about trying to make life difficult for people. It's about finding relief from pain. I hope this was helpful. If it was, please give this a thumbs up. Please subscribe to my channel. Until next time, make it a great day and make it a great week.